What if I told you that one of the most dangerous things for your heart isn't something extreme? It's something millions of people do every single morning without thinking twice. Not smoking, not junk food, not even skipping the gym. I'm talking about a simple morning habit that feels completely normal, even healthy. But according to many cardiologists, it could be silently stressing your heart in ways you never imagined. And the scary part? Most people who suffer heart attacks were following this exact routine the very same day. Before you brush this off, stay with me, because by the end of this video, you might completely change the way you start your mornings. Every morning, your body goes through a powerful biological shift. Around 4 to 6 a.m., your cortisol levels spike. That's your stress hormone. Your blood pressure rises. Your heart rate increases. Your blood becomes slightly thicker. This is called the morning surge. Cardiologists have known for decades that heart attacks, strokes, and sudden cardiac deaths happen most often in the early morning hours, not at night, not in the afternoon, early morning. Now here's where it gets serious. Millions of people wake up and immediately shock their system. They grab their phone, they jump out of bed, they rush, they chug strong coffee on an empty stomach, they check stressful emails, they argue in traffic, all within the first 30 to 60 minutes of waking, and their heart is already in its most vulnerable state. Let's talk about that first common habit, jumping out of bed too fast. When you've been lying down all night, your blood pressure is lower. The moment you suddenly stand up, gravity pulls blood toward your legs. Your heart has to pump harder to push blood back up to your brain. In healthy people, this adjustment is smooth, but in people over 40 or those with high blood pressure, diabetes, or plaque buildup, this sudden demand can strain the heart. That quick, dizzy spell some people feel when they stand, that's your cardiovascular system scrambling to adjust. Now add caffeine. Coffee isn't evil. Let's be clear. In moderate amounts, coffee can even be beneficial. But the timing and context matter. When you drink strong coffee immediately after waking, your cortisol is already high. Your blood pressure is already climbing. Caffeine blocks adenosine, stimulates adrenaline, and can raise blood pressure even further. In someone with arterial stiffness or hidden plaque, that spike can be enough to trigger trouble. Some cardiologists warn that it's not just the coffee itself, it's the combination of morning cortisol surge plus caffeine plus stress. That triple hit. And here's another one that almost nobody talks about: dehydration. After 6 to 8 hours of sleep, you are mildly dehydrated. Even a small drop in hydration thickens your blood slightly. Thicker blood means your heart has to pump harder. Studies have shown that even mild dehydration increases heart rate and vascular resistance. Now imagine you wake up, don't drink water, go straight to coffee, which is mildly diuretic, and rush into your day. Your heart is working harder than it needs to. Let's go deeper. There's a pattern cardiologists see again and again in heart attack patients. The patient wakes up, feels fine, maybe a little stressed, gets out of bed quickly, drinks coffee, starts rushing, maybe shovels snow, maybe runs upstairs, maybe argues. Within an hour or two, chest pain, shortness of breath, sweating, emergency room. Why does this happen in the morning more than any other time? Because your blood pressure can rise 20 to 30 points within the first hour of waking. Platelets, the cells responsible for clotting, are more active in the morning. Your arteries are under more pressure. If there's a vulnerable plaque in a coronary artery, the increased force of blood flow can cause it to rupture. When plaque ruptures, a clot forms. When a clot blocks blood flow to the heart muscle, that's a heart attack. Now think about this. Millions of people wake up and immediately check their phones, news alerts, work messages, social media, financial stress, political arguments. Within seconds of opening your eyes, your brain is flooded with stress signals. Your sympathetic nervous system activates. That's your fight or flight system. Heart rate rises, blood vessels constrict, blood pressure climbs. You haven't even brushed your teeth yet, and your heart is already in overdrive. I want you to imagine your heart like an engine. In the morning, it's warming up, oil is circulating, systems are adjusting. If you slam the gas pedal while the engine is cold, you create more wear and tear over time. That's what abrupt stress does to your cardiovascular system. And here's the dangerous mindset. I feel fine, so I must be fine. Heart disease often develops silently for decades. Plaque buildup doesn't cause pain until an artery is significantly narrowed or blocked. Many people who suffer heart attacks had no warning symptoms. They were going about normal life. Now let's talk about another common morning mistake: intense exercise immediately after waking without preparation. Exercise is one of the best things you can do for your heart long term. But context matters. If you go from deep sleep to maximal exertion without warming up, especially if you're over 50 or have risk factors, you're asking your heart to perform at high output during its most vulnerable time of day. Cardiologists often recommend easing into activity, especially in the morning. There's also blood sugar dynamics. In some individuals, especially those with insulin resistance or diabetes, blood sugar can be unstable in the morning due to something called the dawn phenomenon. Cortisol increases glucose production. If someone wakes up, skips water, drinks sugary coffee, and then experiences stress, glucose and blood pressure both spike. Over years, that combination damages blood vessels. And I haven't even mentioned sleep apnea. Millions of people unknowingly stop breathing multiple times per night. Oxygen drops, the heart strains, blood pressure rises repeatedly during sleep, then morning comes, cortisol spikes, and they jump into stress. Untreated sleep apnea significantly increases the risk of morning cardiovascular events. Now, I want to be very clear. The goal of this video is not to scare you. It's to make you aware, because awareness gives you control. So what should you do differently? First, when you wake up, don't launch. Pause. Sit on the edge of your bed for 30 seconds. Take 5 slow, deep breaths. This alone activates your parasympathetic nervous system, the calm, rest, and digest system. It gently lowers heart rate and stabilizes blood pressure. Second, hydrate before caffeine. A glass of room temperature water within the first few minutes of waking helps thin the blood, support circulation, and reduce that dehydration-related strain. Some cardiologists even suggest a pinch of mineral salt for those without blood pressure issues to support fluid balance. Third, delay caffeine by 60 to 90 minutes if possible. Let your natural cortisol peak and decline slightly before adding stimulants. This can reduce the abrupt spike effect and may even improve energy stability throughout the day. Fourth, avoid immediate stress input. No news, no work email, no social media debates. Protect the first 15 to 20 minutes of your morning like it's sacred. Light stretching, gentle movement, sunlight exposure, these signals regulate circadian rhythm without shocking your system. And if you exercise in the morning, warm up properly. 5 to 10 minutes of gradual increase in intensity allows blood vessels to dilate and the heart to adjust smoothly. Now let's talk about the people who are at higher risk. If you are over 45 for men, over 55 for women, have high blood pressure, high cholesterol, diabetes, a family history of heart disease, are overweight, smoke, or have chronic stress, you should be especially mindful of your morning routine. These risk factors make arteries more vulnerable to rupture under sudden pressure changes. There's something called endothelial function. The endothelium is the inner lining of your blood vessels. When healthy, it helps vessels relax and expand. When damaged by years of high blood pressure, sugar spikes, or inflammation, it becomes stiff. A stiff vessel doesn't adapt well to sudden surges. That's when trouble can occur. Morning blood pressure surge has been linked in studies to increased risk of stroke and heart attack. It's not just the absolute blood pressure number that matters, but how quickly it rises. And here's something fascinating. In cultures where mornings are slower, less rushed, and less stimulant heavy, cardiovascular events tend to cluster less sharply in early hours compared to high-stress societies. That doesn't mean lifestyle alone eliminates risk, but it does highlight how daily rhythm impacts heart health. I want you to think about how your morning feels right now. Is it calm or is it chaotic? Do you wake up to an alarm that jolts you, immediately scroll, rush to beat traffic, drink 2 cups of strong coffee before food, skip hydration, argue, speed? If that's you, you're not alone. That's modern life. But small changes compound over years. Imagine instead waking up, sitting up slowly, breathing deeply, drinking water, exposing your eyes to natural light, moving gently, and easing into mental tasks after your physiology stabilizes. That doesn't require hours. It requires intention. Cardiologists often say heart disease prevention isn't about one dramatic change. It's about consistent patterns that reduce strain on the cardiovascular system over time. Now, let's address a question some of you are thinking. If this were so dangerous, wouldn't everyone who drinks coffee in the morning have a heart attack? No. Risk is individual. Genetics, plaque stability, inflammation levels, fitness, diet, and stress resilience all matter. But if someone already has silent disease, sudden spikes can act as triggers. Think of it like dry leaves in a forest. The leaves may sit there harmlessly for years, but under the right conditions, a spark, wind, dryness, a fire ignites. The morning surge can be that spark in vulnerable individuals. Another overlooked factor is anger in the morning. Studies show that episodes of intense anger temporarily increase heart attack risk several times over in the following hour. If your morning routine involves frustration, yelling, or high-pressure urgency, you're adding fuel to the fire. There's also the issue of cold exposure. In winter, stepping into cold air immediately after waking can constrict blood vessels sharply, raising blood pressure. That's why shoveling snow is a known trigger for cardiac events in susceptible individuals. All of this points to one central idea. Your heart doesn't like sudden transitions. It prefers gradual shifts. Now let's flip this into empowerment. What if your morning became your heart protection ritual? Wake gently, breathe slowly, hydrate, light movement, sunlight, calm focus, nourishing breakfast with protein and fiber to stabilize blood sugar, then caffeine if desired in moderation. These aren't extreme hacks. They're basic physiology-aligned habits. If you're someone who already has diagnosed heart disease, talk to your cardiologist about your morning blood pressure pattern. Some doctors even adjust medication timing to blunt the morning surge. This is individualized medicine, and please understand, this video isn't anti-coffee, anti-productivity, or anti-morning workouts. It's anti-sudden shock to a vulnerable cardiovascular system. Your heart beats about 100,000 times per day. It will beat over 2.5 billion times in your lifetime. It deserves a calm start. The tragedy is that many people only learn about the morning risk after a cardiac event. But you don't have to be one of them. Tomorrow morning, try something different. Don't reach for your phone. Don't leap out of bed. Don't slam caffeine into an already stimulated system. Give your heart a buffer zone. Because sometimes the biggest health threats aren't dramatic. They're ordinary habits repeated daily without awareness. And when a cardiologist says millions are unknowingly increasing their risk every morning, they're not talking about rare behaviors. They're talking about normal routines. The good news, normal routines can be changed. Your heart is incredibly resilient. Improve sleep quality, manage blood pressure, lower inflammation, stay active, eat whole foods, reduce chronic stress, and smooth out those morning transitions. It's not about fear. It's about respect for your biology. If this opened your eyes, share it with someone you care about, because chances are they're doing this every morning too. And tomorrow, when you wake up, remember this. The first hour of your day may be the most important hour for your heart. Treat it like it matters. Have you ever thought about how something as simple as dehydration in the morning could actually put your heart at risk without you even realizing it? Most people wake up, stumble out of bed, grab coffee, maybe skip water entirely, and go about their day completely unaware that their body is already in a state of stress. What happens during those first hours after waking is fascinating and surprisingly dangerous if ignored. Overnight, your body goes without fluids for hours while your kidneys continue to filter and your body continues to function, albeit in a slower restorative mode. This leads to a mild but significant dehydration by the time you open your eyes. You may feel fine, maybe a little groggy, but under the surface, your blood is thicker, your heart is working a bit harder, and your vascular system is slightly strained. It's subtle, so most people don't notice it, but for the cardiovascular system, it's enough to set off a chain reaction that can increase clotting risk, especially in individuals with other risk factors like high blood pressure, diabetes, or pre-existing arterial plaque. When your blood becomes more viscous, you think of it as moving from water toward a syrupy consistency. It moves less efficiently through your veins and arteries. That alone requires your heart to pump harder, and it means platelets, the tiny cells responsible for clotting, are more likely to stick together. This is especially true in the morning when your cortisol levels are naturally high. Cortisol is your body's stress hormone, and it's elevated upon waking to prepare your body to become alert, to get up, and to start the day. The combination of thicker blood and elevated cortisol is, from a physiological standpoint, a perfect storm for your circulatory system. This doesn't mean a heart attack will happen immediately, but it does increase the chances, particularly if your arteries are already vulnerable. Cardiologists have studied this for years and consistently find that cardiovascular events like heart attacks and strokes peak in the early morning hours, not randomly throughout the day. There's a reason for this, and dehydration is a huge overlooked piece of that puzzle. Now, let's break it down further. Overnight, your body loses water through respiration, and for some people, through sweating. Even if you sleep in a cool room, there's still insensible water loss. Small amounts that you don't notice, but that add up. On top of that, if you use the bathroom during the night, that's additional fluid loss. So when you wake up, your total fluid level is already reduced compared to what your body actually needs to function optimally. Without adequate fluid intake first thing in the morning, your blood volume is slightly lower, which makes the heart work harder to push blood through your vessels. This increases shear stress on the vascular walls, and in individuals with pre-existing plaque or arterial stiffening, this can create microtrauma inside the arteries. That trauma can trigger clot formation. Even small clots can be dangerous because they can restrict blood flow to the heart or brain. You might be thinking, I drink coffee in the morning, isn't that enough? The problem is that coffee is mildly diuretic. It increases urine output and can actually worsen morning dehydration if you haven't had water first. People often think caffeine is harmless in the morning, and moderate coffee consumption does have some benefits, but the timing matters. Drinking coffee on an empty, dehydrated system adds another stressor on your cardiovascular system. Platelets are already more activated in the morning. Your blood is thicker. Your arteries are under slightly higher pressure due to the natural morning surge. Adding a stimulant like caffeine can increase heart rate and blood pressure even further, creating the kind of environment where clots are more likely to form. Another factor many people overlook is the role of electrolytes. When you're dehydrated, you're not just losing water, you're losing sodium, potassium, magnesium, and other minerals that are essential for smooth muscle function, nerve signaling, and the electrical activity of the heart. Low levels of these electrolytes can cause irregular heartbeats, palpitations, or increased clotting tendencies. In the morning, your body is trying to recalibrate, and if you're dehydrated and lacking electrolytes, your cardiovascular system is under even more stress. Simple hydration can go a long way toward mitigating these risks. A glass of water immediately upon waking can dilute the blood slightly, reduce viscosity, and help platelets stay less sticky. Some cardiologists even recommend a pinch of natural mineral salt in water for those who are not on restricted sodium diets, as this helps maintain fluid balance and prevent sudden drops in blood pressure that can happen when transitioning from lying down to standing. What's really alarming is how subtle this risk is. People wake up, feel completely fine, and go about their day. They may exercise, have a stressful commute, or dive straight into work. Most of these activities wouldn't be dangerous under normal circumstances, but with mild dehydration and thicker blood, because sometimes the biggest health threats aren't dramatic. They're ordinary habits repeated daily without awareness. And when a cardiologist says millions are unknowingly increasing their risk every morning, they're not talking about rare behaviors. They're talking about normal routines. The good news, normal routines can be changed. Your heart is incredibly resilient. Improve sleep quality, manage blood pressure, lower inflammation, stay active, eat whole foods, reduce chronic stress, and smooth out those morning transitions. It's not about fear. It's about respect for your biology. If this opened your eyes, share it with someone you care about, because chances are they're doing this every morning too. And tomorrow when you wake up, remember this: the first hour of your day may be the most important hour for your heart. Treat it like it matters.